the beginning, World Vasectomy Day existed to support women. It was always a big part of the idea was how do we get men to be better partners? How do we get men to engage? Sometimes, we do a lot of technical webinars, but today is a special one because it's going to be something that is only women speaking about issues and how it's impacting women and what role men might be able to play to support women in these times. Without any more talking, I pass it to you, Silvana.
Ok, Jonathan, muchas gracias. Y así quiero introducir a María Fernanda Cepeda, que es gran amiga de World Vasectomy Day, por muchos años parte de World Vasectomy Day y sigue siendo parte de World Vasectomy Day. María Fernanda, para que ustedes conozcan, la persona que nos acompaña el día de hoy, es directora de investigación y diseño comportamental en el Estudio Latinoamericano de Ciencias del Comportamiento, Estudio Plural. María Fernanda es una antropóloga social con maestría en estudios interdisciplinares en ciencias sociales y de humanidades en la Universidad de Nueva York. Tiene 13 años de experiencia en cambio cultural y comportamental aplicados a la equidad de género, la prevención de la discriminación y violencias, la economía y la ética del cuidado, la salud sexual y la salud reproductiva. También ha trabajado mucho en masculinidades responsables, corresponsables y no violentas y la cultura ciudadana. Desde un trabajo interdisciplinar, María Fernanda ha aportado en la creación y el desarrollo de investigaciones, políticas públicas, así también como soluciones para el cambio social desde el arte, el diseño y la comunicación. Así que es un honor tenerte, Mafe, como todos la llamamos, con mucho cariño el día de hoy para ayudarnos a llevar este panel de estrellas y esta gran experiencia para todos de World Vasectomy Day y la comunidad que nos acompaña.
Vale, muchas gracias, Silvana, World Vasectomy Day, por esta presentación y por esta oportunidad maravillosa que me permiten de liderar este espacio, de moderar este espacio de conversación. Voy a hablar en inglés, no es mi primera lengua, así que también y a las personas que hablan inglés, paciencia. Y the idea is that we can have a conversation today about the commemoration of March 8th. This is a very important date for all women in the world. And I'd like to do to say some words about the meaning of this conversation, and then we can move on presenting our panelists that we are very proud to have today. So I'd like to start saying that today we come together to commemorate March 8th on a global scale, a day that invites us to reflect on the struggles and historical achievements of women in the fight for our rights. It's a day to celebrate the progress we've made toward living lives of dignity and autonomy over our bodies, especially when it comes to our sexual and reproductive health. At World Vasectomy Day, we honor this March 8th by celebrating the incredible work of 7 women leaders from across the globe, particularly in North America, Latin America, and Africa, whose efforts have led to remarkable advances in ensuring sexual and reproductive rights for all. We welcome Edith Muenge, María Eugenia Montesinos, Lea Minton, María Paula Martínez, Sandra Vázquez, and Kelly Welborn, and all the women who are connected today with us to celebrate and commemorate. As is the tradition of World Vasectomy Day, our mission is to break down boundaries and foster transnational dialogues from south to north and north to south. So we're going to have today women, and we're going to introduce them to teach us, to learn from them, to draw inspiration from their journeys. And of course, also because of this March 8th also calls us to action, to speak out, to raise awareness, and to join forces in finding innovative strategies to resist the relentless attacks on our sexual and reproductive rights. From every corner of the world, we've witnessed systematic efforts to undo progress, erode language, and strip away the rights of millions. However, from this platform today, we declare loud and clear, we will not take a single step backward. Today, we speak up with pride, creativity, resilience, collectively reminding ourselves why it's crucial to keep defending our rights. We must remember that we have the power to continue speaking up, to keep amplifying our work, and that we are the ones equipped with the tools to build a better, more just world for everyone. We are the ones championing collective well-being, kindness, love, friendship, support, networks, care, empathy, cooperation, trust, and healing. And today we will be louder, more active, and more united than ever. So let's embark on this journey together to learn, to empower, and to create a collective movement, to continue on building on this collective movement. And by doing so, let's learn and hear from these amazing women that we have today with us. The way we're going to have this conversation is that we are going to invite each speaker to tell us a little bit about the work that they're doing, the effects on this global politics on sexual and reproductive rights, and more importantly, what we can do together. What are the ideas, what are the strategies, what are the alternatives to keep on fighting and rooting for the work that we do. Please, while you hear this conversation and the presentations, if you have a question, let us have the question in the chat. Please write it down in the chat so we can collect them. And at the end of the conversation, we can read some of them and present them to our speakers, okay? So if I have a question, I write it down and send it at the chat that we have active, and then at the end of the conversation, we're gonna collect some of the questions, okay? So let's start. So the first person that I'd like to introduce is Edith Mwenge from Jipaigo. Edith is a highly experienced healthcare professional with over 20 years in nursing, midwifery, and public health. She holds a master's in public health and a bachelor's in nursing sciences, specializing in maternal and child health, HIV/AIDS care, research, and family planning. So welcome, Edith, to this conversation on March 8th. And I'd like to ask you if you could tell us a little bit of the work that you are doing right now and the effects that you have been seeing and impacts of funding cuts in Africa and the global South for sexual and reproductive health. What are your insights? And again, what are the things that we can do together to face them?
Good morning, everyone. I hope you're able to hear me. Hello.
We hear you perfectly.
Hi, everyone. Once more, happy International Women's Day. For those who didn't hear my name, once more, I'm Edith Mwenge. I'm a sexual reproductive health rights expert. And today we're discussing the impact of defunding on sexual and reproductive health rights in Africa and the global South. As mentioned earlier on, today is a women thing, and this affects all women and even men around the country. So we're going to start with our first slide is talking about what is the global gag rule, also known as the Mexico City policy. This is a rule which restricts funding to organizations providing or advocating for abortion services. Also, it's when it comes to historical impact, it was reinstated and expanded by President Trump in 2017. And the severe effects on sexual reproductive health services and Africa in the global South. We can go to the next slide, please. So looking at the 2025 budget cuts, we saw that when President Trump's administration immediately was inaugurated into office and he gave his facelift, he eliminated actually nearly 90% of USAID's budget, which had a direct impact on the global healthcare projects such as HIV/AIDS, malaria, tuberculosis, and polio, and other reproductive maternal-child health, and also reduction in PEPFAR and the President's Malaria Initiative. Coming to our next slide, we look at what impact does it have on sexual reproductive health. This defunding, though it hasn't been shown yet, will lead to reduced access to self-abortion services and also increased maternal infant mortality rates, decreased access to contraception and family planning services, and also we'll see a rise in unintended pregnancies and sexually transmitted infections such as HIV, and also we'll have reduced access to reproductive maternal health services. Coming to our next slide, what is this defunding also lead to? Looking at a case study that was done in Kenya, the global gag rule caused at least 60% reduction in family planning funding, and also it resulted into an increase of unintended pregnancy, especially on the adolescent part. And then when it came to Nigeria, the lack of funding reduced access to safe abortion services, and also which led to unsafe abortions in the community, which led to increase in maternal deaths. And coming to our next slide, it showed that this same defunding had an impact on vulnerable populations. What we mean by vulnerable population, it had effects on the young women, also men, as we see WVD is promoting all these also family planning services to the men. Also the boys and the girls were also not left out. Also we saw rural and marginalized communities were affected, and also gender minorities will be affected. And also people living with HIV and AIDS will be affected. As we know, there's even up to now, no cure has been found for this infectious disease. And most African countries, including the Global South, depend on donor funding to have access to these services. What can be our way forward, or how can we address this issue? Advocacy. We should promote policies supporting sexual reproductive health funding. And then when it comes to support, we should have budgets and organizations providing sexual reproductive health services. And we shouldn't forget about awareness. We should begin from our communities, that is engaged in conversations on the impact of defunding. And also, if we look at the same, we saw that on the way forward, we saw that there was an agreement, especially in Africa, that is in 2001, where the states of African Union countries met and pledged to set a target of allocating at least 15% of their annual budget to improve their health. So there was the Abuja Declaration, which was adopted in April 2001, in a commitment by African Union member states that there should be 15% of allocation towards the health sector, which aims to improving healthcare systems and address the pressing issues. And coming to my own country, Zambia, we see that for the budget of 2025, our government actually allocated about, we had a representation of 10.7% of total budget, according to 2025 national budgets. So when it comes to, next slide, please. And I end my way forward, I think I end my presentation here. And then in conclusion, defunding has critical consequences for sexual reproductive health in Africa and the Global South. So USAID funding cuts have actually worsened the situation, because most of these funded programs were funded by USAID itself. A few were funded by other donors. And then collaboration and advocacy are crucial to ensure that sexual reproductive health services remain accessible. What is our call to action? towards this problem. We have to take action today. We have to share a voice. Our voices should be heard. We should use sexual reproductive matters on social media. What else? Support sexual reproductive health organizations through donor or volunteering, those who are able to. And above all, we should stay informed, engaged, like the way we are doing today, which is very vital on Women's Day. As we know, women are very vulnerable in sexual reproductive health services. Engage in discussions on sexual reproductive health policies, which will help improve sexual reproductive health services. I end my presentation here, and happy Women's Day once more to everyone. And thank you so much for allowing me to present this presentation. Thank you.
Thank you so much, Edith, for this very important presentation and for letting us know what are the landscape of the impact of the cutting of fundings for sexual and reproductive health. We share the preoccupation and we share the call to action that you have made about what we can do and what we have to keep on doing in terms of not letting these topics and not having them go their way without us speaking up and sharing information and having this conversation and coming together. I believe one of the things that we have been feeling through these days is the idea of can we come together and have conversation about what is going on, and can we create strategies and ways to turn this into another direction. So this conversation, hearing from you, Edith, is very valuable for us to have in mind what is going on in Zambia, in Nigeria, in Kenya. What are the governments also doing? How are they stepping up in covering what needs to be covered, and how can we as a community respond? So thank you so much. Please, if you have any question to Edith, don't forget to write it down, and we can go a little bit more. We can continue with this conversation going to North America. We have the presence here of Maria Eugenia Montesinos and Leah Minton. I'm gonna introduce them to you, and then we're going to ask them as well questions in terms of the situation that we are facing and all the strategies, ideas, and projects that we can still and we will be continuing on working to face and to rise. So Leah Minton is the first advanced level midwife fellow at the Mayo Clinic and board president of the Midwives Alliance of Hawaii. She has extensive experience in reproductive health care and advocacy. She has provided primary care in rural communities, lactation support, gender affirming care, abortion services, and STI, STD prophylaxis. Also, I'd like to introduce to you Maria Eugenia Montesinos. Maria Eugenia is the director of midwifery at NYU Langone Health, and she has 24 years of experience in midwifery and women's health. She leads a team providing comprehensive patient-centered care, including contraception counseling, family planning, and well-woman exams. So I'm very thrilled to have this conversation with them as well. And we would like to know, Maria Eugenia and Leah, again, what are your thoughts and insights in terms of the situation that we are facing globally after hearing as well Edith that shared with us what is the impact in Africa and the global South? What are your thoughts about this situation, and also how can we learn from midwifery, all the ways in which midwifery has resisted historically, and how we can learn from you in terms of, again, How can we engage more people? How can we turn this situation? So thank you so much for being here, and we are here to learn from you.
I think I'm going to start. Thank you very much for inviting us. My name is Eugenia Montesinos. I am a midwife here in New York City, and along with my colleague Leah Menton, who is from Hawaii. Today, we're going to just give you a global view of what is happening nationally here in the United States, and therefore affected globally. As we can see, Edith, her powerful message and introduction, what happened, what is happening. And we also have our all national issues that is happening here. It is affecting all women, all reproductive health. And so therefore we have a view that it will come out, and it's just starting, and it's gonna get, as we go, it's gonna go all the way globally, all the way to South America, all the way to Africa, all the way, everywhere. It will get affected. So to begin, first of all, I just want to say thank you to World Vasectomy Day for being our allies in this feminine movement and this reproductive health. So that is one of the big things for us, that we also join them, because we feel that you are our best allies for us because we focus in a lot of women reproductive health, but with their participation, we also now seeing that men have to be part of this movement, because it's a family issue at the end. So this is one of the things that we have to talk about it. As I said, we're gonna focus from, and here in New York is completely, we are what we call the blue state. So we can do abortions, we can do all kind of offers in reproductive health. But if we go to a smaller state, which we call red states, it's already prohibited. You can't have an abortion. You can't have any of those things that we're gonna be focusing. Leah is gonna give you her view on what advances we're doing in Hawaii. As you know, United States is a big country, and every state has their own unique phases that we have in reproductive phases that we go. So for everybody of you that you may not know, that midwives, we are at the front line of the health, reproductive health. We offer globally, not only we do birth, we do abortions, we do reproductive care, we do a complete care, not only of the woman, we also care of the family. So midwives are every single place, from the little, small, remote areas globally. And this is, we see, including in wartime. So we are in there completely with the families. And so I think this is a right place to talk and make an awareness that every single one, men and women, should join to this movement, because this is gonna affect all of us. It affects the economy, affects the environmental. So all those things is gonna be affected. So right now, I think we are in a crucial time to join together in a big force globally and really change it. And so today, I think I'm gonna be introducing Leah. More or less, she's gonna give you what we wanted to do. We wanted to think outside of the box. Normalcy is no longer normal, and because these times are not normal, and we gotta face it. So therefore, that is why we join World Vasectomy Day, because we wanna work together, being allies, being trained to offer not only care to a woman, but reproductive care in men, that it will be our allies. So take ahead, Leah.
Thank you, Eugenia. I'm just going to do a very brief presentation on one of the ways that we're looking to take action and invite others to do so in their states or countries. And this is, of course, in addition to all of the great points that Edith shared with us all, and because all of that advocacy must continue as well. So, due to our topic being solutions in action, we wanted to talk about ways that midwives are able to facilitate vasectomy. And as we know, the non-scalpel vasectomy is a form of male birth control and is an outpatient procedure, which is important to note that we don't refer to it as a surgery because midwives don't perform surgeries in the United States. We perform procedures. And so some states do allow for nurse practitioners to perform them, but we did not find that they specifically allowed for certified nurse midwives. The American College of Nurse Midwives, which is our organization in the United States that defines our scope of practice for certified nurse midwives and certified midwives, updated their scope of practice, and that included family planning services for all genders, which vasectomy is a family planning service. And so now that our scope of practice is very specific around providing care to all genders, that really opened that up for midwives to be able to provide vasectomies. And the World Health Organization states vasectomies can be provided by associate clinicians as part of the established competencies, which midwives, would be an associate clinician. And so with that, just going through the process that I went through in Hawaii, in order to have our Board of Nursing, which is who licenses and regulates me in Hawaii, to basically ask them to interpret that our state statute, our laws and rules allow for me as a midwife to provide vasectomy in Hawaii. And this is also the same type of a process we would recommend for anybody to consider in their country or states. And so just looking at providing your licensure agency with the history, any precedent. So I utilized precedent of nurse practitioners doing this. And then looking at our scope of practice documents, was able to reference our ACNM scope of practice, and then also training pathways to support being able to attain the skill sets to do this. So I shared with them that World Vasectomy Day does offer training and require documentation and continuing education so that there's a process to document that training in order to demonstrate competency and ensure that somebody has oversight of my training. And with that, you have to know your own laws in the areas that govern your license and looking at your scope of practice. But we did want to highlight that the International Confederation of Midwives scope of practice does say that the midwives may extend to sexual and reproductive health care, and within the essential competencies, it does say to administer contraceptives to the scope of practice. There is a piece that says that we would refer women or partners for sterilization, but it also, again, does say that we can provide contraceptives according to the laws. And so that can potentially be interpreted within your countries to be able to allow for midwives to do vasectomy. And then doing the hands-on training, which World Vasectomy Day will be sharing more about, where they'll be doing trainings this year as well as in the future. And depending on where you're working, then there can be reimbursement either paid for by the patient's insurance and or potentially by the Department of Health or other entities that do cover the reproductive services. And so back in 2022, our Hawaii Board of Nursing interpreted that non-scalpel vasectomies are within the scope of practice as long as we've received appropriate education and training. Currently, since I'm a fellow at Mayo Clinic in Minnesota, I've inquired with the Board of Nursing in Minnesota. But my interpretation of the laws here in Minnesota is that it would allow it. As an example, looking at New York State, where Eugenia is, when we reviewed that, I looked at the laws there, and that would actually require legislative change to change the statutes that govern midwives' practice there. So it may not always be interpreted that you can request for the governing body to say that, yes, you can. It may require legislative change, and that would be additional steps, such as introducing a bill to change the scope of practice or the state statutes. And so in conclusion, we just wanted to additionally advocate for midwives to be able to offer non-scalpel vasectomy, to expand access to them and family planning services. And as we said, that the International Confederation of Midwives Essential Competencies for Midwifery Practice, which really is looking at a global view, does say provide contraceptives in alignment with local laws and protocols. So we do believe that that helps other countries be able to support midwives in doing vasectomies. And we just wanted to say Happy Women's Day as well. Thank you.
Thank you so much, Maria Eugenia and Leah. Wow, this brings yet another interesting perspective on what we understand as innovation and what we understand as opening up spaces for expanding sexual and reproductive health. I don't know, Maria Eugenia, if you want to add something to what Leah was sharing with us. We have a little bit of minutes. If you want to conclude anything.
One of the things that for everybody here to understand United States, it's each state have their own laws and in terms of how much we can do as a midwives. So it is a lot of we can't just say in the United States everybody can do it. It has to be a state by a state. There is so many other restrictions in different states. We are in states that are actually more open, yet in New York, I can't change it. So we are in the process to make it this more for every single state. But as I said, all of us, we live in different states and we with different laws and of practice. So we are gonna start a movement. So one of the things that is important, once we have one state and the next one and the next one. So for us, Leah is our leader in the United States in terms to be the one performing the vasectomies as a midwife. And one other thing that we are constantly working with the International Confederation of Midwives also. So I belong to them and we are very aware. I was going to invite her, but she's in another event. And so we are in constant talking about globally how we can change, how we can think about outside the box now. It's not only about contraception in women, but we wanted to offer that part for contraception in men. One of the crucial things that everybody have to understand, when we see a couple having children, or a couple, or whatever their families, we are the closest to them. They actually see us much, much more intimately all through that 9 months. So we have a close relationship that they trust us. So they trust us to having their own child. So they can trust us to have that. By the time they're gonna see a neurologist, it makes an extra effort for the person or for the man who really wanted to have. So that is one of the things we want to focus, since we are completely with them during the whole process of the pregnancy and birth and everything. We are very close to them and we have the trust of them. So I think we are in a crucial role that we can actually make a difference, not only, as I say, nationally, but globally. So we are talking with our president, who is Chilean, actually the International Confederation president. So we are in the talks and hopefully we'll get to a point that will change globally.
And if I could actually just share one really quick thing, just for example, and also thinking about when we are trying to implement, that workflow into wherever we are providing care, thinking, as we've talked about, I like to say within the box, because we have to work with what we have access to in a lot of places before we can get to what's outside the box. And so just as a quick example, one of the things I'm proposing is we have midwives on staff for our labor and delivery unit, but at the same time, we have a midwife on our postpartum that's doing rounds, that also does what we call, some outpatient procedures prior to, to bringing people in if they need to be medically induced into labor. And so there's some wiggle room in that postpartum schedule. And my proposition, because many people choose to get the vasectomy after the baby is born, that essentially utilizing the ability of that postpartum midwife to have a vasectomy schedule available so that if people wish to get on that schedule and be able to receive their vasectomy, then they can get in sooner because it's an otherwise flexible schedule that doesn't normally have appointments of other patients during that day. And so just thinking about how can we best use the time when a midwife is on service and working in the setup that people's workplaces have, like how can we integrate getting that vasectomy in for clients, even if it's not before people are discharging out of the hospital, but that there is that available space in somebody's schedule to be able to get that in. And then, of course, that can potentially generate more income during that shift as well. So just sharing that, like, we can always think about different ways on how to best utilize midwives' skill sets and time to serve families while they're already working.
Thank you so much, Leah and Eugenia. I have learned so much in this 7-minute talk about how midwives can change the world that we are experiencing right now. And thinking about what Edith mentioned earlier in terms of how it is important to understand that sexual and reproductive health funding cuts affects the entire planet and every single person. It is also listening from you so interesting to see that allowing the knowledge of midwives and the experience and expertise and expanding this expertise not only to sexual and reproductive health of women, but also in terms of men and the family, as you mentioned, can also change the world and can also, for example, break the barriers that we and the resistance that we know, for example, men have in terms of joining the conversation. And I believe it's so interesting, Maria Eugenia and Leah, how you mentioned these moments of postpartum and this where the family and the couple and the network is very open to make changes or to make like decisions, how midwives can interact and can give and trust, right? And a space in which vasectomy and all other procedures can happen. So thank you so much, because I believe it kind of like completes the circle in terms of what we are talking about when we talk about sexual and reproductive health. It is not only like a portion of the conversation, it's about the whole world and the family and the collective well-being. So thank you so much. I know people have questions. I have been receiving a lot of questions. So at the end of the conversation, we're gonna collect them so we can expand the conversation. Thank you so much. And let's move to the south now. Having all these new insights, let's move to Latin America. And since I'm moving to Latin America, I'm gonna switch to Spanish so I can have a conversation with Maria Paula and Sandra. Maria Paula, un gusto saludarte. Muchas gracias por estar acá, por acompañarnos. Me gustaría presentarte rápidamente para que podamos saber quién eres, de dónde nos acompañas y seguir en esta importantísima conversación. María Paula Martínez es la directora ejecutiva de FP 2030, LAC Hub, y es abogada con una experiencia de 25 años defendiendo los derechos de niñas, adolescentes, jóvenes y mujeres afectadas por el conflicto armado, por la violencia basada en género, por la migración y el cambio climático en América Latina y en el Caribe. Muchísimas gracias, María Paula, por estar aquí, por acompañarnos y por unirte a esta conversación que está cada vez más enriquecida con todo lo que hemos escuchado de nuestras compañeras. Y nos gustaría escuchar tu experiencia desde Colombia, desde América Latina, en esta doble conversación que estamos viendo, los efectos y lo que significa hablar de derechos sexuales y reproductivos en este momento a nivel global, los efectos que tiene, digamos, que haya un ataque a la financiación y en general a, digamos, a esta conversación, pero también cuáles son las oportunidades que vemos alrededor de involucrarnos colectivamente en este esfuerzo, de involucrar a hombres, de involucrar a la sociedad en general. Entonces, muchísimas gracias de nuevo por tenerte, por unirte a esta conversación y te escuchamos.
Gracias, si te parece, te respondo a lo largo de la presentación que tenemos preparada
Claro que
para
sí.
el día de hoy. Quisiera felicitar a todas las mujeres panelistas que me acompañan el día de hoy, agradecer a nuestro gran aliado, como decía María Eugenia, el World Vasectomy Day, y a todos los colegas y al equipo que han facilitado el que hoy podamos celebrar juntos. Family Planning es una alianza internacional que aterriza en América Latina para invitar a los estados a que hagan más en favor de la agenda de planificación familiar, anticoncepción y derechos sexuales y reproductivos. Family Planning 2030 fue conocido en África y en Asia durante muchos años porque fue ahí donde comenzamos este relacionamiento con los estados. Y solo a partir del 2023 hemos llegado a América Latina y el Caribe. Estamos basados en Panamá, aunque mi acento sea en español de Colombia. Y la idea es seguir invitando a esos compromisos y a la inclusión de la vasectomía como parte de esos compromisos. Y esos compromisos significan un compromiso político de ampliar la oferta de métodos anticonceptivos a disposición de hombres y mujeres. Significa ampliar la financiación, significa formar más personal de salud en estos métodos y significa finalmente demostrar un compromiso con la agenda y el no retroceso de la misma. En esa medida, todos nos unimos a los Objetivos de Desarrollo Sostenible 2030 y por eso es importante analizar el día de hoy, el Día Internacional de la Mujer, y en este espacio organizado por el World Vasectomy Day, el tema del monopolio femenino de la anticoncepción. ¿Por qué seguimos cargando con la responsabilidad? Y es algo interesante porque todas nosotras mujeres, el día de hoy, nos felicitamos por ser mujeres, pero también nos abrazamos porque la responsabilidad del cuidado, del tiempo que dedicamos a los demás, a pensar, ¿no? Y a ocupar nuestra mente en muchos temas es cada vez mayor. Por eso, seguimos las mujeres cargando la responsabilidad principal de la anticoncepción y es una pregunta constante entre nuestros compromisarios que ya alcanzan a más de 100 en América Latina y el Caribe. Reflexión en la sociedad actual que consideramos de gran relevancia para la celebración de hoy, el Día Internacional de la Mujer. Adelante. La herencia histórica y médica nos dice que la anticoncepción es, comillas, un problema de mujeres. Y este enfoque y el que sea, comillas, un problema de mujeres, surgió en parte porque los cuerpos femeninos fueron considerados el campo de batalla para las políticas de control poblacional, mientras que los hombres quedaron al margen de estas discusiones. Nos preguntaba Mafe, ¿qué oportunidad tenemos en estos momentos donde la agenda retrocede y no sentimos avances? Lo primero es recordar la historia, para, como dicen muchos historiadores, no repetirla. La historia de la anticoncepción moderna ha estado marcada por un enfoque casi exclusivo en las mujeres. En razón de los roles tradicionales de género en muchas culturas, en donde la responsabilidad de la planificación familiar recae en la mujer, ya que se la considera la primera cuidadora de la familia y de los hijos. Desde el desarrollo de la píldora anticonceptiva en la década de 1960, la planificación familiar ha sido vista como una herramienta para controlar la fecundidad femenina más que como un esfuerzo compartido entre géneros. Muchos de ustedes el día de hoy atendiendo este webinar son especialistas en ver en la práctica cómo esto se sigue dando en muchos de los contextos en África y en América Latina. La idea de hoy es invitarlos a superar estas barreras y a recordar que juntos podemos más. Siguiente. El sesgo de género en la investigación científica, y si hay aquí investigadores o miembros de la academia, estudiantes, jóvenes que nos oyen, ha tendido a priorizar los métodos femeninos por razones prácticas y culturales. Al ser las mujeres quienes enfrentan las consecuencias directas del embarazo, se asumió que ellas debían ser las principales responsables de prevenirlo. Además, los ensayos clínicos de anticoncepción masculina han enfrentado obstáculos no solo médicos, sino también sociales, ya que las farmacéuticas, y esto va para los colegas de Organon, de CAT, Bayer, entre otros, sino también sociales, ya que las farmacéuticas las han considerado que la falta de interés masculina no garantiza un mercado rentable. El World Vasectomy Day y todos sus aliados se han encargado de difundir la idea de que a pesar de pronto tener la percepción para las farmacéuticas del sector privado de que no es un mercado rentable, finalmente estamos hablando de realización plena de derechos. Así que seguimos evidenciando que los métodos anticonceptivos siguen siendo limitados en comparación a la vasta oferta de los métodos disponibles para las mujeres, pero está en nuestras manos cambiar esta realidad. Siguiente. Y eso nos lleva a seguir trabajando para superar las barreras de género, en donde para muchas sociedades persiste la idea de que la reproducción es un ámbito femenino y exclusivamente femenino, de que el estigma asociado a la anticoncepción y la sexualidad unida a la falta de educación hacen que las mujeres asuman la responsabilidad de la planificación familiar sin involucrar a sus parejas masculinas. Por eso en América Latina y el Caribe, muchas iniciativas, plataformas, grupos activistas, organizaciones internacionales y de Naciones Unidas trabajan los temas de nuevas masculinidades. Y ahí nosotros nos unimos como Family Planning a explicar el rol tan importante que tiene el hombre en la planificación familiar. Y es que unido al anterior, no olvidemos que hay una percepción errónea de que la anticoncepción masculina afecta la virilidad o la masculinidad. En todos los webinars organizados por el World Vasectomy Day, traemos este tema porque sigue habiendo esa sensación que a pesar de explicaciones que van en contrario, es decir, en donde decimos que no afecta la virilidad o tú no eres menos hombre por decidir hacer la vasectomía, esto nos lleva a pensar que permanece y persiste una resistencia a métodos como la vasectomía o la participación activa en decisiones anticonceptivas porque no hemos logrado superar estas barreras antes mencionadas. Siguiente. La carga mental y emocional invisibilizada está demostrada en que las mujeres no solo llevan la carga física, es decir, el efecto secundario de los métodos anticonceptivos que ellas decidan emplear, sino también una carga mental considerable que incluye recordar las citas médicas y las dosis diarias, que no se me vaya a pasar la hora de la pastilla, que tenga disponibilidad de esos métodos en el momento de querer sentir placer o tener relaciones con alguien, enfrentar las consecuencias de un método fallido, navegar conversaciones complejas con sus parejas sobre protección y planificación familiar. Y es por eso que hoy traemos este estudio de Guttmacher Institute del 2022, en donde el 83% de las mujeres encuestadas dijeron sentir que, aunque sus parejas apoyaron el uso de anticonceptivos, la responsabilidad final siempre recaía en ellas. Y al parecer, esta responsabilidad de apoyar el uso de anticonceptivos se mezcla con la responsabilidad del hogar, del trabajo y de mantener una familia. Adelante. Siguiente. La falta de opciones equitativas para los hombres efectivamente hace pensar que debemos seguir trabajando en la equidad. La equidad va a ser el tema con el que se cierre este webinar y que será el epicentro y el núcleo central de la Conferencia Internacional de Planificación Familiar que tendrá lugar en noviembre de este año en Bogotá, Colombia, en donde podremos revisar en varios de los espacios que tenemos pensados muchos de los coorganizadores en analizar cómo actualmente las opciones anticonceptivas masculinas están limitadas a preservativos y vasectomías. Los esfuerzos por desarrollar anticonceptivos hormonales masculinos han sido lentos y la falta de diversidad en las opciones para hombres refuerza la idea de que las mujeres son las únicas responsables de la anticoncepción y tienen un monopolio sobre ello. Por eso aplaudo el día de hoy a los hombres que hoy nos oyen o a ellos que han decidido apoyar a sus parejas y que logran cambiar este paradigma y esta presunción de base de la discusión que hoy tenemos para la celebración del Día Internacional de la Mujer. Siguiente. Y ya para concluir, un llamado a la acción, ¿cómo podemos romper este monopolio? Tanto Lea como María Eugenia nos daban muchas ideas de cómo trabajar con las midwife en muchos lugares del mundo y apoyarnos en ellas para seguir trabajando y promocionando el tema de la vasectomía. Los que trabajamos en temas más amplios o con aliados que trabajan en una especificidad que se acerca a la realidad de las comunidades indígenas, afrodescendientes, gitanas, migrantes y afectadas por las distintas crisis en el continente de Latinoamérica y el Caribe, los invitamos a seguir a nuestro lado desafiando las normas sociales, promoviendo campañas educativas que fomenten la corresponsabilidad en la planificación familiar con métodos como la vasectomía. Debemos seguir al lado del World Vasectomy Day, capacitando a más personal de salud. Y por eso, los contactos privilegiados de los ministerios de salud en la región de Latinoamérica y el Caribe deberían incluir a todos aquellos profesionales que estén abiertos a conocer más y hacer más. Esto incrementaría su uso y la seguridad de un hombre al realizarse el procedimiento. Debemos exigir innovación científica. No nos dejemos con las presiones que tenemos ahora de las agendas en relación a todo lo que nos contaba María Eugenia. Debemos presionar a la industria farmacéutica ahora más que nunca para acelerar las investigaciones en anticoncepción masculina y asegurar que los programas de la salud sexual y reproductiva, incluidos en las políticas públicas que seguimos promoviendo todos, involucren activamente a los hombres ofreciendo información y acceso a métodos anticonceptivos para todas las personas. Siguiente. Con esto solamente podemos concluir que la planificación familiar es una tarea compartida, como ya muchos de nosotros lo habíamos manifestado, y Mafe lo expresó muy bien como moderadora. Involucrar a los hombres no solo equilibra las responsabilidades, sino que también mejora la calidad de vida de toda la familia. Debemos apoyar inevitablemente el que la desigualdad de género se siga dando cada vez en menores proporciones. La falta de empoderamiento de las mujeres en algunas sociedades ha llevado a que las mujeres asuman esa responsabilidad de la anticoncepción sin tener acceso a recursos y apoyo adecuado. Está en nuestras manos brindarlo. No nos dejemos como sentir miedo por la situación que está pasando a nivel mundial. Juntos somos capaces y el desarrollo de alianzas nos llevará lejos. Un placer haber estado acá con todos ustedes.
Te agradezco mucho la mirada y el llamado a la transformación cultural porque creo que también termina siendo un ingrediente más a todo lo que han venido sumando nuestras expositoras sobre la importancia que tienen las normas sociales y los valores, las creencias alrededor de los roles de género. Y si me preguntan, yo diría que mucho de lo que está pasando hoy en día digamos, se ha parado sobre esos mismos valores que se resisten, digamos, a transformarse, entre otras cosas, por agendas que los han querido seguir reproduciendo. Ahí, digamos, me parece muy, muy importante el llamado que nos haces a entender de nuevo que la salud sexual y reproductiva aunque históricamente se ha vendido como un tema de mujeres, es un tema, como hemos visto, de todas las personas, ¿no? Y ese cambio comportamental, muy probablemente vamos a ver cómo se agilizan y se facilitan los cambios que queremos. Yo ahí hago una cuña porque creo que también desde este mundo de la salud sexual y reproductiva, desde el enfoque de género, también debemos entender cómo cambiamos las personas, porque también digamos que nos hemos enfocado mucho en que las personas cambiamos siempre vía educación o vía información y no es el caso necesariamente. Ahí las ciencias del comportamiento tienen mucho para ayudarnos a ver de qué manera podemos entender cómo movilizamos emociones, cómo movilizamos normas sociales y cómo también innovamos desde allí. Creo que World Vasectomy Day ha hecho un muy buen trabajo viendo el lugar de la comunicación, el lugar de las narrativas y qué se puede hacer desde allí, porque sí nos toca también innovar desde ese lugar. Entonces, muchísimas gracias, María Paula, por lo que nos cuentas, por lo que nos enseñas. Y en ese orden de ideas, entonces, vamos a seguir bajando por América Latina para irnos nos dices, María Paula, que tú estás en Panamá. ¿Cierto? Y nos vamos entonces ahora para Argentina a saludar a Sandra Vázquez, que también nos acompaña el día de hoy y que también pues tiene todo eh, digamos, una trayectoria y también como una invitación a hacernos en el marco de la reflexión de este 8M. Quisiera presentarla rápidamente, presentarte Sandra. Sandra tiene 40 años de experiencia en el desarrollo de programas en salud y en el desarrollo. Ha sido líder en la salud, en la salud sexual y reproductiva de adolescentes y tiene, digamos, también 30 años de experiencia en el sector salud en general. Su carrera incluye haber trabajado en el hospital Dr. Cosme Argerich en Buenos Aires, donde ella pues ha tenido una parte protagónica en los servicios de salud adolescente y en el departamento tecnológico, lo interpreto así, súper. Entonces, Sandra, pues un gusto saludarte de nuevo, bienvenida a esta conversación tejedora de perspectivas alrededor de la salud sexual y reproductiva en estos tiempos tan retadores y nuevamente nos unimos a preguntarte cuál es tu perspectiva, tanto desde la experiencia que tienes trabajando en salud sexual y reproductiva en un país como Argentina, que ha sido históricamente también abanderado de estos temas que nos ha enseñado muchísimo a nivel regional y que también en este momento pues está enfrentando muchísimos retos. También cuéntanos cómo han abordado el manejo de la vasectomía, la participación de los hombres y por qué es importante hablar de esto en el 8M. Un gusto saludarte y bienvenida, Sandra.
Bueno, buenos días, buenas tardes y buenas noches para todas las personas que hoy nos están acompañando desde distintas latitudes del mundo. Para mí es un honor y un placer enorme, enorme poder compartir esta actividad organizada por el World Vasectomy Day y llevada adelante mediante gente realmente muy, muy comprometida con su misión y que apuestan a que Argentina se sume a los tantos países de Latinoamérica que brindan servicios de vasectomía ambulatoria sin bisturí. Entonces les cuento un poquito sobre la institución a la que represento, que es FUSA. FUSA es la institución a la cual pertenezco o represento. Es una organización sin fines de lucro que durante más de 30 años trabajamos tratando de mejorar, es una misión como muy, muy abarcativa, la calidad de vida de las personas a través de la promoción, la prevención y la atención integral de la salud, pero de una perspectiva de género y de derechos humanos, que ahora parece una verdad de perogrullo, pero desde hace 30 años que luchamos en esto y no era lo común. Porque no solo tomamos en cuenta sus factores biológicos y psicosociales, sino también el estilo de vida, el ambiente físico, cultural, la familia y la interacción con sus pares. La siguiente, por favor. Casa Fusa son los centros que tenemos de atención integral de la salud y tenemos varios, algunos ubicados dentro del ambiente aquí del Capital Federal y el conurbano bonaerense y otros en otras provincias. La idea es poder trabajar en forma federal, tal como decían las compañeras anteriores. Argentina es un país federal con 23 provincias y una ciudad autónoma, con la cual puede haber normativas nacionales, pero después cada provincia o cada estado, como lo llaman en otros países, regulará y trabajará con normas propias. La siguiente, nosotros para eso y para trabajar en forma federal llevamos adelante un programa de telemedicina donde podemos no solo acompañar en las cuestiones de salud, sino a través de las otras áreas con las cuales trabajamos, que tienen que ver con la incidencia política, con el acercamiento a jóvenes, con trabajos en la comunidad. Y dentro de este servicio que brindamos, tenemos 3 pilares básicos que son la confidencialidad, el acceso a la información y el derecho de todas las personas a decidir libre y autónomamente sobre su cuerpo y sobre su vida desde esta perspectiva que les contaba interseccional. Particularmente ahora, desde hace un año, en esta nueva gestión, estamos sufriendo, al igual que todas mis colegas anteriores han enumerado, una fuerte restricción, un retroceso que diría nos lleva a unos 20, 30 años atrás en todo lo que significa alcance, acceso en derechos de salud sexual y reproductiva. La siguiente, por favor. Solamente para mostrarles algunos números de las prácticas, de las prestaciones que venimos realizando del 2024. Y nosotros realizamos también, en general, salud sexual y reproductiva dentro de un marco de atención integral, pero tenemos la posibilidad desde hace muchos años de realizar interrupciones anteriormente legales del embarazo y a partir del 2020 interrupciones voluntarias del embarazo. Lo comento porque los números son realmente distintivos y porque es una oportunidad cuando uno tiene una mujer que esté pasando por una situación de la decisión de interrumpir un embarazo y si tenemos la posibilidad de ver a su compañero, también ofrecerles el servicio de vasectomía. Gracias al acompañamiento del World Vasectomy Day en este año, el año pasado, 2024, hemos llegado a alcanzar una cifra de 201 vasectomías. Por ser el primer año de realización, estamos muy orgullosos de esto. Aclarando que en Argentina la vasectomía no es accesible, que solo la realizan los urólogos en general y no la hacen jamás sin bisturí y sin anestesia general, nunca ambulatoria. Con lo cual es prácticamente imposible porque no solo el costo, sino tener que pasar por todo ese proceso habiendo disponibilidad muy escasa de quirófanos. La siguiente, por favor. Bueno, en esta foto quería mostrar y hacer hincapié en que esta fue la capacitación que recibimos por parte del World Vasectomy Day. Ahí están 2 de nuestros urólogos, Jonathan y Ana Cepeda. Quiero destacar, seguramente Ana está en esta presentación, es uróloga, es mujer, es venezolana y viene luchando por estos derechos. Y bueno, la idea nuestra es poder a través de ellos transmitir estos conocimientos y capacitar a otras partes del país. Como les decía, un país federal con muchas limitaciones en algunas cuestiones. Creo que contamos con la presencia hoy de Claudia Castro, que es quien está a cargo de hace muchos años de la Dirección de Maternidad e Infancia de una provincia del norte, fronteriza con Bolivia, y que está luchando y quiere también capacitar a sus profesionales para poder hacer vasectomía sin bisturí en Jujuy. La siguiente, por favor. Bueno, y un poco parece que me puse de acuerdo con María Paula, ¿no? Contando un poquito la historia de los métodos anticonceptivos. Y es increíble que en nuestro país, teniendo una muy amplia legislación en materia de derechos sexuales y reproductivos, la voluntad política de brindar acceso a servicios de vasectomía nunca ocupó el lugar que debería tener Y por eso la idea es reflexionar un poquito rápidamente la historia de los métodos anticonceptivos junto a ustedes y tal como lo adelantó María Paula. Desde 1549, en que el doctor Falopio creó sus primeros preservativos, en ese entonces eran de tripa de animal y lino, a los fines de evitar la propagación de una epidemia enorme de infecciones de transmisión sexual, pero no se investigó como método anticonceptivo. Y esto es importante recalcarlo. Y recién en la década del 50 comienzan las investigaciones sobre las primeras píldoras anticonceptivas de la mano de Margaret Sanger y de Gregory Pincus, entre otros. Pero recién en 1960 recibió la autorización de venta la comercialización de pastillas anticonceptivas. Y si bien la investigación para la utilización de dispositivos ya dentro del útero se remonta desde mucho tiempo atrás, recién en la década del 60 comenzó su introducción en forma masiva. Pero lo más llamativo es que respecto de la vasectomía, en 1893 en Londres, el doctor Harrison realizó la primera intervención, pero tampoco con fines anticonceptivos, solo era para provocar atrofia de la próstata. La siguiente, por favor, nos hace pensar con esta historia y con la realidad actual, que cabe preguntarnos por qué tuvo tantos avances científicos tan importantes en los métodos anticonceptivos que utilizan las mujeres y se invirtieron millones y se invierten millones de dólares en la investigación de nuevas moléculas, de nuevas modalidades en las vías de absorción de los diferentes métodos. En fin, dispositivos variados para que cada mujer tenga muchísimas opciones para elegir después de un buen asesoramiento. Pero, ¿qué sucedió en todas estas décadas con los métodos que están disponibles para los hombres? La verdad, muy, muy poco avance. La siguiente, por favor. Pero bueno, hoy estamos en un día muy especial, hoy se conmemora el Día Internacional de la Mujer, extiendo mi gran abrazo a todas las mujeres aquí presentes, y donde tenemos que reflexionar en que no es un festejo, realmente no es un festejo, es una ocasión de reclamo de derechos, de reclamo de acceso a servicios y de igualdad. Es por eso que valoramos enormemente, enormemente las acciones que se realizan en relación a la sensibilización, a la información, para que los hombres puedan tener realmente acceso a un método anticonceptivo eficaz, seguro, sencillo y definitivo. Y el World Vasectomy Day hace una gran labor para aportar a este cambio. La siguiente, por favor. Y en esto, también reflexionando en las conductas sociales y los mitos, hay muchos tipos de situaciones que plantean los varones que consultan por una vasectomía. Lo típico es aquellos varones, aquellos hombres que consultan porque ya han completado su esquema familiar, porque sus compañeras presentan dificultades para la utilización de distintos métodos anticonceptivos. Por ejemplo, vemos muchas mujeres que tienen múltiples cesáreas, son hipertensas, no pueden consumir anticonceptivos orales, en fin. Y esos hombres, como grandes compañeros, se informan, es nuestra misión informarlos, quitarles todos los miedos y que decidan si quieren hacer una vasectomía, y es como un acompañamiento amoroso a su compañera para que deje de usar métodos anticonceptivos. Pero también hay otros hombres, hay varones que saben que tienen patologías genéticas que potencialmente las pueden transmitir a su descendencia y eso los preocupa y solicitan una vasectomía. Pero quería hacer hincapié en algo que, por lo menos en Argentina y creo que en todas partes del mundo, hay mucho mito, ¿no? También existen hombres muy jóvenes que decidieron que nunca van a querer ser padres y que solicitan acceso a ese derecho, y necesitamos que no sean juzgados, que no sean estigmatizados, o lo que es aún mucho peor, que se les niegue esa práctica. Bueno, en esto estamos fuertemente acompañados por World Vasectomy Day. Estamos convencidos de que lo vamos a lograr, de que podemos llegar a distintas partes del país llevando estas capacitaciones, esta concientización, estamos viviendo en Argentina momentos muy difíciles. Por el momento no han podido cambiar las leyes, sí han podido desfinanciar, como hablaban las colegas de otros países, y el desfinanciamiento acompaña a una falta de acceso. USA está muy comprometida en esto. Lamentamos terriblemente la falta de acompañamiento a partir de decisiones de Estados Unidos, del presidente Donald Trump, que repercuten en organismos de cooperación internacional como UNICEF, UNFPA, OPS, con los cuales trabajamos habitualmente. Esperemos que esto se frene aquí, que no haya cambios legislativos, que no volvamos atrás con todas estas cuestiones. Ya hubo una marcha atrás en relación a la hormonización y a los criterios ideológicos que esta gestión presenta, pero bueno, vamos a seguir resistiendo, vamos a seguir acompañados de todos ustedes que siempre hemos luchado juntos. La siguiente, por favor. Entonces, esto es un poco lo que les venía diciendo. Queremos continuar impulsando para lograr una distribución más equitativa de esta responsabilidad anticonceptiva, como decía María Paula. La siguiente. Solo agradecerles por este espacio. Es un honor y un placer para mí estar acompañado de todos ustedes. Muchas gracias.
Muchas gracias, Sandra, por esta presentación que nos haces y por dejarnos ver un poco del panorama en un país como la Argentina en términos de, de la discusión, del abordaje también tan ecosistémico que tienen alrededor de la salud sexual y reproductiva, que eso me llama muchísimo la atención en relación a todos los ámbitos que deben tenerse en cuenta para poder sostener y ofrecer servicios integrales de salud sexual y reproductiva. Aún así, los retos inmensos que tú planteas en relación al acceso, ¿cierto? Y a cómo que exista, digamos, dentro de la norma no significa que los hombres pueden acceder de manera efectiva y oportuna a los procedimientos de vasectomía. Ese es un reto para toda América Latina. También lo hemos visto en otros países africanos y en Asia, pero el acceso entendido no solamente desde lo legal, sino también desde cuáles son los recursos, la política pública y cómo todas estas decisiones pues están llegando allá. Que se desfinancien las políticas de salud sexual y reproductiva implica que el acceso al final no se hace de manera efectiva. Entonces, muchísimas gracias por esta perspectiva. También te agradezco mucho por el llamado a entender que este 8M es una oportunidad de conmemoración de los avances y de la lucha colectiva, pero también de esta mirada crítica de que no estamos allí. No estamos en un lugar, digamos, todavía de equidad e inclusión y que debemos pues seguir manteniendo esta lucha. Muchas gracias también a World Vasectomy Day por todo el ejercicio de acompañamiento y por este movimiento que vemos que tiene implicaciones globales y que tenemos que seguir apoyando. Y digamos que ya estamos llegando al final de este webinar. El último espacio que quisiéramos compartir con las personas conectadas es llegar a Colombia. En este momento subimos de Argentina o volvimos más al norte de América Latina para hablar de la Conferencia Internacional de en Planificación Familiar que va a tener lugar este año aquí en Colombia. Esta es, digamos, como todos los eventos en relación con los derechos sexuales y reproductivos, con el enfoque de género y con todos estos esfuerzos, pues también ha tenido que enfrentar unas barreras muy importantes para llevarse a cabo. Sin embargo, la decisión ha sido mantener y defender este espacio, esta conferencia. Y para eso entonces vamos a invitar a nuestra última panelista, a Kelly Wellborn, que nos va a hablar un poquito sobre esta conferencia, de qué se va a tratar, qué vamos a hacer, qué podemos esperar en este noviembre del 2025, sobre todo en esta coyuntura global. So Kelly Wellborn is a leading expert in sexual and reproductive health and rights with extensive experience in global program management. As a senior program officer at the William H. Gates Institute, she strengthens collaboration between platforms and local partners to advance equitable reproductive health access. Thank you so much, Kelly, for being with us. And we've been having a very rich and insightful conversation around sexual and reproductive health today in this commemoration of March 8th. And it is very important for us to hear that we are actually having a conference to have these conversations and to keep on advancing in knowledge and discussions and evidence in terms of sexual and reproductive rights. Maria Paula was mentioning the importance of not forgetting history and not letting us to forget all the things that we have advanced. So I believe it's so crucial to hear from you. What are your insights in terms of this conference, what we can expect from the conference, and the invitations that we all have to be there to keep on having this conversation?
For sure. Thank you so much for having me. I greatly appreciate the opportunity to be here and to speak with all of you about the ICFP. We've been hosting conferences since 2009, quite a long history of conferences throughout Africa and Southeast Asia. But now we're turning our eyes to Colombia, and we're very excited to be coming to Latin America for the first time and bringing the International Conference on Family Planning to a new region that's just really got so much to share with the rest of us. And so we're very excited to be bringing the conference to Bogota, November 3rd through the 6th. There will be quite a number of pre-conference events that are happening on the lead into that, and a number of events that happen throughout ICFP. So really wanting to just have everybody on this call go online to the ICFP.org and see what all you are excited about participating in, because there are 11 subcommittees that represent a number of sectors of the family planning and reproductive health space. And they have really vibrant groups that are planning to host pre-conference events. They're planning to have events throughout the ICFP proper, the conference. We have an ICFP live stage that has specific slots for those subcommittees to jump up on and tell the world what they're excited to share, whether it's research, program implementation, best practices, or advocacy efforts, because as we all know right now, advocacy is so important to be pushing our messages around reproductive health, family planning, et cetera. So you can join 11 subcommittees there. I wouldn't join them all, but maybe choose one to join so that you can really get involved with helping to push that particular sector's messages out to the larger community, but also get everybody on the same page as far as abstracts that you're presenting, research that you're doing that you want to share with the rest of the world, and those advocacy efforts again that are so incredibly important. I don't know if you have the presentation, but I'll go through just a brief overview of ICFP and kind of what we are and why this particular conference now is so important in light of what's happened with funding, not just from the United States, but from other governments across the globe. And so it's really a rallying cry at this point to get as many people as we can to continue to push their research forward, even in light of the funding that we're seeing dwindling, continuing to push those advocacy efforts to ensure that family planning and reproductive health stays on the global agenda, even though there are so many that are pushing against it. And so thank you for pulling that up. I'll have, if you can just go to the third slide there, and we can showcase the trajectory that ICFP has been on for the last gosh, 20 years. But we started pulling together researchers from across the globe to talk about their research and share it and build partnerships around it so that we could continue to ensure that the evidence that was being presented that shows what a benefit family planning and reproductive health is to different countries, not only to individuals, was so important to get out there. And so we started in 2009 in Uganda, and we ended up realizing we were expecting 800 people. There were 1,200 people that showed up to that conference, including ministers from across Africa. And we said, okay, this is something that is going to be a very powerful way in which we can all across the community, no matter what sector we're serving in, whether it's the private sector bringing in commodities, whether it's the NGOs or the advocates or the faith leaders. We really needed a place as a community to come together and to make sure that we were all working toward the same thing and pushing in the same direction. So we have built the conference up, and our audience, if you'll go to the fourth slide, please, to about 50,000 people. And what the power of those 50,000 people is mighty. And so what we work to do is bring those people together, not just once a year at the conference, but throughout the year on the web at these different events that are happening across the globe, which we call drumbeat events that get people excited about the conference and coming together for those 4 event days. But it is a movement now. It is not just a conference that happens every few years. And it is a movement that has been built by the community that we're sitting in the middle of. So we have over 4,000 participants at the last conference. We were, until this latest financial freeze, as we're going to call it, took place, we were expecting about 5,000 people to converge in Colombia, and we are still hoping that we can see that. So we are pushing all of our partners to make sure that we're able to bring as many people as possible to the conference itself, and we're asking people to really to make sure that they are there, to be able to share out, to be able to bring others with them, not just from the family planning sector, but also those that are related to the work that we do, whether it's women and child health, HIV and AIDS. We're really all trying to come together and push for the same things, the right to health for all of us. And so we're looking forward to converging in Colombia and bringing not just those 4,000 people that are going to be there in person with us, but the world that is watching online. So we'll also have a number of our highest scoring sessions that anyone and everyone across the globe will be able to see, to log in and see if they can't be there in person, because we realize that there are going to be funding hurdles that people are going to have to deal with and contend with on the way into the conference. But we have over 300 sessions that take place across the 4 days of the conference. And so we'll have those that focus on research and the data that's coming out showing, the incredible power of family planning. We'll have those focused on advocacy efforts. So if you're an advocate and you've had some great successes for family planning, reproductive health at large, please do submit an abstract, and we'll stick the abstract link, the submission of abstract links in the chat. And then again, the program implementation piece of this, if you have an excellent program that you've just seen great success with, or even want to talk about something that you saw that failed in your work for a particular program implementation, but that you want to share with the globe to say, this this didn't work in this context, but then we rejiggered some things and we've seen great success with this. All of those things are so incredibly helpful for people to come together and share and then spread back to their own communities when they come back home. So we'll have those 11 subcommittees with multiple activities. We'll have about 300 sessions that we call our scientific sessions that go through our scientific program. And then we have a number of sessions that we'll have on the big stage that we'll invite in the whole world to, not just those in person, but also those online, to have discussions with the leaders in the field, whether they be young people, ministers and parliamentarians, or those that are leading international non-governmental organizations, and really having these conversations to continue to push things forward across the globe. We're hosting a conference this week coming up on Wednesday and Thursday that is a touch point to the ICFP, where we'll be talking about priorities, especially in light of all that's happening and all the pushback that you're all seeing likely across your work. And we'll be pushing toward the priorities of the entire community and centering those in those particular conversations that we have on the big stage at ICFP, so that we can ensure that we are focused on the right topics, because now it's so important to get it right when we touch down at the conference in November in Bogota. So we're going to be also thinking about what events need to take place on the road to Bogota now, specifically in light of the financial freeze, so that we can be incredibly prepared for those conversations in November. And so what we're asking people to do is join those subcommittee conversations. So you see on your screen the international and national subcommittees that join up to form the full international scope of the subcommittee work. We have subcommittees in program implementation, in communications, private sector, humanitarian and crisis settings, and on, youth, faith leaders. So we're hoping that this community will join up with our international steering committee subcommittees and the national steering committee subcommittees, so that we can all be working from the same playbook and making sure that we are pushing toward the same goals for ICFP. I will go to the next slide and just walk you through the theme of this ICFP. We worked very hard with the community across the board to get to a theme that really resonated deeply with everyone. And that theme is equity through action, advancing sexual and reproductive health and rights for all. And it is now a rallying cry at this point, because we've seen such pushback on equity and reproductive health and rights and justice. And so we are very excited to be centering everything that we're doing at the conference coming up in November through this lens, through that equity through action lens. And so if you'll go to the next slide, we'll show you what the tracks are that you can submit abstracts in, either program implementation, advocacy, or research, that all-important research to show the value of family planning across the board in so many ways. So you'll see here in Spanish, in this version, all of the tracks. If you are a non-Spanish speaker, you can click on or take a picture of the QR code, and it will take you to the page that you'll be able to see all of the tracks in English and French as well. They're also our official languages of the conference. But we are going to be taking those abstracts until April the 19th. So please go online, get familiar with all of the different topics that you can submit to. You'll notice that the number 14, that last topic, is basically a catch track. You should be able to find anything and everything you would like to present in the first 1 through 13 tracks. But if you can't, that 14 track is that place that you say, oh, it just doesn't fit in here and here and here. That's the place that you can find where your abstract will fit. We have things talking about using art to promote family planning and reproductive health. There's just a number of things that we've outlined in that track that are still very important for us, I feel, to continue to push forward and to make the world aware of. And then I will also say that if you feel as if you feel a little hesitant to submit an abstract, there are plenty of tools online at the icfp.org that will help to showcase how you can submit an abstract. You don't have to be a researcher at a research university to submit an abstract to ICFP. It is really, it's the largest scientific conference on family planning for sure, but it is also that place for program implementers and advocates to share your work and to share what's working. So please don't, if this is your first time submitting an abstract to a conference to go and present the work that you've been doing that you're so excited about, please don't let that be a barrier. Go online and look at the tools that will help you submit a real high quality abstract to the conference so that you can be there to share that work that you're so proud of and that can help others that are trying to do the same things with their work. If you'll go to slide 8, we are also asking for abstract reviewers because with all of the abstracts that we usually get over 4,000 abstracts submitted to the conference. We need abstract reviewers to make sure that those abstracts are of high quality before they're presented at ICFP. So we usually accept about half of the abstracts that are presented, that are submitted. But we're really very excited to be able to work with quite a number of people across the community who have been reviewers for us in the past. And we clearly will need more reviewers as we move forward with the new edition of Spanish as an official language, because we're accepting abstracts in Spanish. And so we do need reviewers that are adept at program implementation, research, and then that advocacy that's so important. So if you are an advocate, a program implementer, or a researcher that would like to share your skills and your knowledge and really help us to make sure that all of the presentations that are going to take place at ICFP are top quality, it would be great if you would help us by signing up as an abstract reviewer. Then I'll take us down to those tools on slide 10. There are videos that will walk you through in English, French, and Spanish how to write a successful abstract for ICFP. So you'll see the videos there on the slide, but you'll be able to sit down with them on your own time on your computer and walk through exactly what is expected in those abstracts. I will say that because of the foreign assistance freeze, there are a couple of things that we're doing on our side, on ICFP's side, to ensure that everybody has access to the presentations and such, but also to the conference. So we know that there's going to be, it's going to be tough for everybody to get there because of travel funding. So I'm going to take you to slide 11, if you would pull that. There are a number of things that we are doing to ensure that we're involving as many people as we can. And one of the things I'm going to ask you to do right now is if you have, and I know most of you do, have wide networks of researchers and advocates and program implementers, please send them, if you'll go to slide 11, the call for abstracts. We really want to make sure that everyone across the board can jump in and submit an abstract, that they know about the conference, that they can submit their work, so that we are sure that everything is that everyone has the same opportunity to be accepted to the conference. And then as far as the modifications to meet the moment, we are increasing the number of travel dollars that we're setting aside for not just young people. We have in the past traditionally given what we call a young researcher award to about 100 young people. Once they get their abstract accepted to the conference, we bring them on board. This time we know that there are going to be quite a few struggles to get anyone, no matter what their age, to the conference. And so what we're doing is bringing in additional travel funding for those that are over 35 by the time of the conference. So we will, when you submit your abstract, there'll be a little box to check to see if you feel as if you need some additional funding to get to the conference itself. And if you do check one of those boxes, then when your abstract is accepted, you'll get an application to fill out to get some of the travel funding that we've set aside. As far as the high scoring presentations, we are going to live stream those out to anyone and everyone so that people, even if they can't be at the conference itself, will be able to see those sessions. And then because we know that we're not going to be able to bring absolutely everyone that has a presentation that they would like to give, but doesn't have the travel funding to get there, we are going to add an online specific session track. So we'll have those again from every single one of the tracks that will have those presenters that can't make it to the conference presenting online. So they'll be presenting online, and there will be an online audience for those particular presentations. So we're making some of those opportunities available for people that won't be able to get there to Columbia and present their work, because we want as many people presenting work as possible. So we'll have that as well. And then I will tell you that we have extended the deadline for abstract submission to that April 19th date, because that's the date of the stop work order was supposed to be lifted. And so we've extended the date, not just for those that were impacted by the stop work order from the federal government, but those that are those that weren't impacted at all still have that additional time to get their abstracts in. And then last but not least, I'm going to take you through slide number 14. We have a newsletter that comes out that keeps everybody abreast of the different changes and such that are happening across the field, but also across the conference. So the ICFPE newsletter is something where you can go online and sign up for that newsletter so that you're the first to know about any updates across the community, through the subcommittees, through our core organizing group, and as well through the community that we work with from 120 plus countries across the globe. So if you want to get that newsletter, there's a place that will drop into the chat that you can sign up to receive that. I believe that Catalina already put the link to the subcommittee signups in the chat. We again would really love for folks to be there and able to be a part of those communities that really help to build all of the activities that are happening before and during the conference itself. And then I'll share with you the sponsor page. We do have a number of sponsorship opportunities available. Many people choose to host side events at the conference. So it's a nice place where you can host and highlight some of the programs that you have going on within your community or within your organization. So we have many opportunities, different opportunities for you to ensure that the work that you're doing with your organizations are highlighted across the conference in multiple ways. It's the way that we get the funding to not only put the conference on, but to bring those scientists and advocates and program implementers to the conference so that they can share that research and information and best practices with the group. And then the biggest thing that really is near and dear to my heart, and I think a lot of the people that attend ICFP, is the the integration of the next generation into this conference. We have, as I was talking about earlier, been really cognizant of ensuring that young people are in this conversation and their work is being highlighted across the different opportunities that ICFP brings, not only in person, but across the platform, the ICFP platform, in the form of webinars or other conference side events and such. So we really want to draw your attention to a special youth champion sponsorship opportunity. That's on slide 16. We have that conference badge indication for people that are bringing young people from their own organizations, as well as people that are sponsoring young people to come to the conference. Because, as they like to say, they're not just the future. Youth are not just the future. They're the present. They're what's happening right now. And they are the ones that are going to be moving this conference and all of the important work that is done by researchers and advocates and program implementers into the future. And so it is incredibly important that we pass along that torch, that we pass that torch to these young people that are attending the conference and sharing their work and building their network so that they can continue to move all of this incredible work into the future. So I'll stop there, but I'm here to answer any questions that folks have about the conference itself and the myriad of topics that are covered across the board.
Congratulations, because I believe we all saw the effort that you put into creating space again and creating access for everyone to be part of this conversation. I totally agree with you that we need to bring people together. And I was thinking about like a call to action to end this webinar. But at the end of the day, the call to action is we can all join and we can all meet at this conference, and it's a great place where we all, as I saw, can meet and can see our work reflected.
Exactly.
So thank you so much for all the effort, for all these amazing ideas of how to make this accessible and how can and all the ideas of we creating this collective community. We run out of time at this point, but it is a humanity goal to protect and to resist. So thank you so much, everyone, for staying with us, for having actively listened and sharing all the ideas. Thank you to all our speakers. Thank you to World Vasectomy Day. I think we are super inspired now, and I think that all these spaces and opportunities to engage in conversation, now we have them, and the final thing I want to say is that we have to see each other in November here in Colombia, and we'll be very, very honored to welcome you all. So thank you so much.